Year brought an expansion of Medi-Cal coverage expansion for all 26 to 49-year-olds, no matter of their immigration status. Huge move right here. So Dr. Ramiro Zuniga is the medical director of HealthNet, here to talk about their All Are Welcome campaign. Thank you so much for joining us this morning. This is tremendous change for California. So first question that I think a lot of people are wondering is, besides the age range that we just mentioned, 26 to 49, what other qualifications do immigrants have to have in order to get this Medi-Cal coverage?
Yeah, there are many factors that determine whether an individual or a family qualify for medical, full scope medical benefits. And that includes the size of the household income, and of course the age of the members in the household. To find more information, anyone can go to benefitscal.com.
Okay, perfect. And then does that coverage extend to someone's kids or their spouse?
Yes, with the new law that went into effect as of January 1, 2024, all ages, this new law includes specifically ages 26 through 49. But this is an expansion of a previous coverage expansion that had included already young adults, 19 through 25, and adults 50 and older.
Okay, good. And I noticed on the website, I mean, it breaks down everything that people need to have right there. But some of these people that are undocumented immigrants, they are experiencing homelessness. So they don't have access to the internet. They don't even have access to the TV and know what's going on. So how are we reaching this population specifically?
Yes, HealthNet's All Are Welcome campaign that you mentioned earlier aims to spread the word to all the adults that are now covered for full scope medical. And we are partnering with community-based organizations who are on the ground. We are utilizing many social events, cultural events, on-the-ground events to help spread the word about these changes.
So going to these different communities and campus and saying, hey, by the way, you are eligible for this.
Absolutely, and it's also social media, it's paid advertisement, radio, all a multi-channel campaign to help spread the word.
Okay, perfect. And then what documents do they need, and is this an easy process for non-English speaking people?
Yeah, there are interpreter services. People can go to benefitscal.com to find if they are eligible, but HealthNet can also help them, and the medical interpreter services will help through the process.
Okay, and then as far as immigration status and also DACA recipients, does that impact the way that they get this coverage?
Immigration status does not matter.
Okay.
The fact that somebody applies for a full scope medical does not affect, doesn't disrupt or change their immigration status or their chances of becoming a U.S. permanent resident or citizen. When someone applies for state-funded benefits, that information is only used to determine if they qualify. State privacy laws protect that information.
Perfect. And one more time, where can people find this information?
Yes, the best place is benefitscal.com.
Perfect. Thank you so much, Doctor, for coming in and breaking this down for us. Again, this is a huge policy change for California, so we appreciate your time.
Thank you for having me.